1. Which of the following best describes the primary purpose of the Certified Brain Injury Specialist (CBIS) credential? A. To provide rehabilitation to patients with spinal cord injuries. B. To recognize professionals with expertise in brain injury services and supports. C. To certify medical doctors in neurosurgery. D. To replace state licensure requirements for allied health professionals. 2. Which type of brain injury is most commonly associated with diffuse axonal damage? A. Traumatic brain injury caused by rotational acceleration. B. Stroke involving the middle cerebral artery. C. Hypoxic brain injury due to cardiac arrest. D. Subarachnoid hemorrhage from aneurysm rupture. 3. A coup-contre-coup injury occurs when A. Only the site of initial impact is damaged. B. A penetrating object injures the brain tissue. C. The brain is injured at the impact site and on the opposite side. D. There is widespread microvascular bleeding. 4. What is the most appropriate initial management for elevated intracranial pressure in a patient with severe TBI? A. Immediate hyperbaric oxygen therapy. E. Elevating the head of the bed and optimizing ventilation. C. Early aggressive mobilization. D. Routine oral hydration. 5. Which Glasgow Coma Scale (GCS) score range indicates a moderate traumatic brain injury? A. 3 to 5. E. 6 to 8. C. 9 to 12. D. 13 to 15. 6. Which of the following best describes post-traumatic amnesia, PTA? A. Loss of long-term memories before the injury. B. Loss of memory for events after regaining consciousness. C. Period when the patient cannot form continuous new memories. D. Inability to recall the incident causing the injury. 7. Which of the following is a common long-term cognitive consequence of moderate to severe brain injury? A. Hyperlexia. B. Impaired executive functioning. C. Increased eidetic memory. D. Enhanced multitasking skills. 8. Which interdisciplinary team member is primarily responsible for helping patients with TBI regain communication skills? A. Occupational therapist. B. Speech-language pathologist. C. Rehabilitation psychologist. D. Recreational therapist. 9. Which of the following is considered a secondary brain injury? A. Direct laceration of brain tissue. B. Epidural hematoma from a skull fracture. C. Ischemia due to cerebral hypoperfusion. D. Diffuse axonal injury at the moment of trauma. 10. What is the primary goal of community reentry programs for individuals with brain injury? A. To increase hospital readmissions for closer monitoring. B. To transition patients from rehabilitation facilities to active social and vocational roles. C. To teach patients to avoid all physical activities. D. To replace medical treatment with counseling only. 11. Which of the following is a hallmark symptom of frontal lobe injury? A. Hemianopia. B. Impulsivity and poor judgment. C. Ataxia. D. Aphasia. 12. Which medication is commonly prescribed to manage spasticity after a brain injury? A. Baclofen. B. Acetaminophen. C. Amoxicillin. D. Omeprazole. 13. In the context of pediatric brain injury, which statement is true? A. Children recover fully from severe brain injuries due to brain plasticity. B. Brain injury may interfere with developmental milestones and academic progress. C. Pediatric TBI rarely affects social skills. D. outcomes are generally worse in adolescents than in infants. 14. Which of the following strategies is most effective for reducing agitation during TBI rehabilitation? A. Increase environmental noise to improve focus. B. Provide structured routines and limit overstimulation. C. Encourage unmonitored physical activity. D. Remove all rest periods to improve endurance. 15. What is a common symptom of mild traumatic brain injury, MTBI? A. Deep coma lasting several days. B. Gradual paralysis of extremities. C. Headache and brief loss of consciousness. D. Persistent aphasia. 16. When educating family members about brain injury, which recommendation is most appropriate? A. Emphasize that recovery is identical for every patient. B. Discuss realistic expectations and the potential need for long-term support. C. Minimize discussion of behavioral changes to reduce anxiety. D. Advise avoiding professional help to encourage independence. 17. Which of the following best defines neuroplasticity? A. Ability of the brain to produce cerebrospinal fluid. E. Formation of scar tissue after trauma. C. Capacity of the brain to reorganize and form new neural connections. D. Enlargement of ventricles in response to injury. 18. Which complication is associated with prolonged immobility after a brain injury? A. Pulmonary embolism. B. Aphasia. C. Photophobia. D. Vertigo. 19. Which of the following is a reliable indicator of a favorable prognosis after TBI? A. Early return of pupillary light reflexes and motor responses. B. Persistent decerebrate posturing. C. Prolonged absence of brainstem reflexes. D. Repeated seizures within 24 hours. 20. Which therapy approach focuses on training patients with brain injury to use memory notebooks and electronic reminders? A. Sensory integration therapy. B. Cognitive rehabilitation therapy. C. Constraint-induced movement therapy. D. Vestibular therapy. 21. Which of the following is most associated with a poor outcome in severe brain injury? A. Early spontaneous eye opening. B. Short post-traumatic amnesia duration. C. Hypotension and hypoxia in the early post-injury period. D. Early return of speech. 22. What is a common emotional or behavioral change following damage to the limbic system? A. Loss of visual acuity. B. Emotional lability and irritability. C. Hemiparesis. D. Dysphagia. 23. Which type of rehabilitation focuses on teaching patients with TBI strategies for problem-solving and organization? A. Vocational training. B. Cognitive rehabilitation. C. Recreational therapy. D. Physical therapy. 24. Which of the following is the most appropriate initial intervention for a patient with TBI who demonstrates dysphagia? A. Offer large volumes of thin liquids immediately. B. Refer for a swallowing assessment by a speech-language pathologist. C. Allow patient to eat solid foods without monitoring. D. Begin oral feeding during periods of drowsiness. 25. What is the leading cause of traumatic brain injury in older adults? A. Assault. B. Falls. C. Motor vehicle collisions. D. Firearm injuries. 26. Which diagnostic imaging modality is most useful for detecting acute intracranial hemorrhage? A. MRI with contrast. B. CT scan of the head. C. PET scan. D. Functional MRI. 27. When addressing vocational rehabilitation goals for individuals with TBI, which is most important? A. Focusing solely on physical strength. B. Matching tasks to cognitive and physical abilities. C. Avoiding feedback to reduce stress. D. Encouraging immediate return to previous employment. 28. Which of the following is a common cause of non-traumatic brain injury? A. Blunt force trauma. B. Stroke. C. Sports collision. D. Blast injury. 29. Which area of functioning is most likely to be impaired after injury to the temporal lobe? A. Auditory processing and memory. B. Balance and coordination. C. Visual field perception. D. Motor strength. 30. Which patient behavior suggests impaired safety awareness after a TBI? A. Following therapy instructions carefully. B. Frequently attempting unassisted transfers despite fall risk. C. Using adaptive equipment consistently. D. Requesting supervision during mobility tasks. 31. Which of the following is a common post-concussive symptom? A. Persistent headache and difficulty concentrating. B. Sudden paraplegia. C. Immediate loss of bladder control. D. Complete loss of visual fields. 32. What is the primary purpose of a Rancho Los Amigos scale assessment? A. To evaluate cerebral perfusion pressure. B. To assess levels of cognitive functioning after brain injury. C. To grade motor strength after TBI. D. To measure intracranial pressure. 33. Which brain structure is most responsible for maintaining balance and coordination? A. Hippocampus. B. Cerebellum. C. Hypothalamus. D. Thalamus.